I'm a little bit nervous to do this video, but I think it's important because there are probably topics, words, labels you've heard, but maybe aren't quite clear on what they are because we all lump them together. My goal with this video is not to scare anybody. It's really to just educate you on things that you likely will need to think about for yourself and for your person with dementia. It's also just to help you make an informed decision. As with all my videos, please bring this topic up with your primary care provider, with your medical providers, with your loved one's healthcare providers. This is really to just help you make an informed decision and maybe help guide that conversation with your healthcare provider. So this can be a difficult topic, as you can already tell. So many of you may have heard the terms full code, DNR, DNI. I want to talk about what those mean and some things to consider. Each of those terms, which I'll explain in a minute, they have to do with end of life care. In several past videos, I have talked about advanced care planning. Advanced care planning also has to deal with end of life care and about making a lot of decisions that can be quite difficult. And how do you make those decisions based on what you think your loved one would have wanted? I'm going to link to all of those videos below in the description. Today, I want to talk about 3 different decisions that you will likely have to make about your loved one's end of life care. These decisions are often called life-sustaining treatments or LSTs. A life-sustaining treatment is any treatment designed to prolong life. Some specific examples include CPR, mechanical ventilation, basically when a machine breathes for you, and even certain surgeries. The first term you may have heard is code status. Code status is just a fancy way of saying what actions does this person want us to take if they were to stop breathing or their heart was going to stop. There are generally 3 options for code status: full code, DNR, or DNI. Some hospitals may have different options, but those are the 3 main options you'll hear about. Let's start with being a full code. If somebody is a full code, it means that they want anything that can be done to help keep them alive. So, for example, if their heart stops beating, they would want anything to be done to help get their heart to start beating again. For instance, chest compressions, electric shock, defibrillation, whatever needs to be done, make it happen. If they stop breathing, they would want a tube put down their throat to help them breathe again. The next option, the next type of code status would be a DNR, a do not resuscitate. This means that if your person with dementia stops breathing or their heart stops, they don't want any CPR. They don't want any chest compressions or shock, defibrillation. It also means that medications to help restart the heart won't be given. And then there is DNI, do not intubate, which is different than a DNR. Do not intubate basically means do not put a tube down that person's throat to help them start breathing again. So you might be wondering why somebody might not want a life-sustaining treatment. Why would somebody want to be a DNR or a DNI? This is a really good spot to talk about statistics of CPR. I'm telling you this just so you have the stats. I'm going to link an article in the description below so you can learn more, and certainly use this as a jumping off point to talk to with your doctor and with your loved one's doctor. It is up to you and your loved one to determine what is best for your case. CPR, cardiopulmonary resuscitation, we see this sometimes a lot depicted in movies and in TV shows, and it kind of seems like it's like fine. People get CPR and they tend to come back and bounce back, but that's not really in reality how it works. CPR is basically using chest compressions and breathing to help get the blood circulating and oxygen circulating again throughout the body. A lot of what you see on TV and in the movies tends to portray CPR as being pretty successful. In 2013, there was a study published in the New England Journal of Medicine where they took a look at individuals who received CPR in a hospital setting. I want to focus on the individuals in that study who were 65 years old or older. Those individuals who received CPR in the hospital setting, 51% of them did survive that CPR procedure. So about half passed away, half survived. Of the 51% who survived, 34% of them died before they were ever discharged from the hospital. So even though they survived the initial CPR, they passed away before they were able to be discharged from the hospital. That means the individuals 65 years and older, only 17% of them who had received CPR in the hospital ever made it to discharge. Of that 17% who made it to discharge, only 10% were alive 1 year later. The other thing to keep in mind is that if somebody is receiving CPR, their body, their oxygen is not getting to their brain. The blood is not getting to their brain. So the likelihood of there being some long-standing brain damage is also pretty high. Again, my goal is not to scare you with this at all, but just to really, I think, be informed and bring up discussions with your healthcare provider about what CPR or intubation or a full code status or a DNR, DNI might mean for you and your loved one. I've talked in other videos about the importance of quality of life or quantity of life. And some people might be learning about CPR and might be looking at those risk factors, looking at the statistics and thinking, this doesn't really look like that great of a thing. Why would somebody who's an older adult want CPR? Well, for some people, they might have a really important landmark event or life event coming up, like a grandchild's graduation or a wedding they really want to attend. And so for those reasons, they may very well choose to be a full code to try to make it to that event. Other people I've worked with and met with, they care much more about quality of life and not the quantity of life, and they want to be a DNR and DNI. Again, personal choice. But I think it's one thing to hear those terms, CPR, DNR, DNI, full code. And it's another thing to really understand how would that impact somebody's life long term if they were to receive those things. So as a quick recap, there are three main ways in which people can choose to address an end of life concern should their heart stop beating or they stop breathing. They can be a full code, meaning do everything that needs to be done to get me breathing again, get my heart pumping again. They can be a DNR, which is do not get my heart started again. And they can be a DNI, which is do not get me breathing again. Do not intubate me. You can be a DNR and a DNI. Now, I will say my mom was a DNR and a DNI. She ended up being taken to the hospital by emergency paramedics to the nearest emergency room where they had no idea, like they did not know of her. The place she usually went to was full. They were being diverted. It is a hospital's job for the most part to try to keep any human being alive. So as soon as they got her, they intubated her right away, even though she's a DNR, DNI, because they didn't know that. They didn't have that in writing. So in some cases, even if you've made the decision for a DNR and or a DNI, sometimes depending on emergency circumstances, that hospital, that emergency room may not be able to follow through because they didn't know. They don't have that paperwork. I hope this information helps you and helps your loved one make the decisions that are best for you. Do you have any other questions or concerns about what a full code status means or a DNR or a DNI means? I think palliative care providers are really excellent in this area to talk to, as well as hospice providers, which if somebody's on hospice, they're definitely going to be a DNR, DNI. But those individuals and those professionals are really great to speak to what would be the outcome, what would be the quality of life if somebody was to receive these procedures? How would their life likely be after surviving something like that? A lot of times we see the people coming out after CPR and they seem to be like just fine afterwards, when it's really an uphill battle and a lot of damage physically and cognitively can be done during those procedures. I don't think that's talked about enough. All right. I hope this helps. I know this is a little bit different than usual, but I certainly do hope it helps you think of some questions and topics and what you would like to have done for you and your loved one. All right. I'll be back with another video. In the meantime, keep up the great work. Bye. Oh, and if you don't know already, I do have a free TV guide. You can download it. It's got my top 100 episodes separated into category with brief descriptions. So rather than spending hours and hours on the internet trying to find maybe a video you're looking for, you can go directly to a category you're interested in and scan some of the topics and specific videos I have in those topics, and then just click the link and watch. That is for free for you in the description. All right.